Because the justification for lockdown measures is to save lives and to save lives from COVID specifically, of course. And then the argument is also is protecting the NHS. Never really thought it was my job to protect the NHS, their job to protect my life rather than the other way around. But that people who would otherwise be expected to get treatment, often life-saving treatment at the NHS, won't be able to get it. Not routine operations, cancer treatment, others, if the NHS is overwhelmed by COVID cases. That is the argument that we're given. The same reason, again, schools have to close, not because kids are at any risk, but they could be a risk to other people by bringing the infection back. You're Professor of Pathology, former Professor of Pathology. You've been looking at, death rates over the years. Looking at the data that you see now, the data that the government itself presents, the ONS data, Public Health England, NHS England data, are we in the middle of a pandemic that is costing tens of thousands of lives?
Well, in a simple word, no, we're not. I mean, what we're in the middle of is a pandemic of poor quality data. And unfortunately, around the world, governments are enthralled to advisory bodies who are not scientifically representative and are using data selectively and very tendentiously. One of the big problems is that this disease isn't clinically diagnosable. So it doesn't have a clear clinical footprint. So it overlaps with a lot of other respiratory diseases. So the only way you can sort of properly diagnose this disease is by a test. And normally laboratory tests are developed over a long period of time, and they're verified and made sure that actually that they are testing what they are testing and that you're not getting false positive results and not getting false negative results. The PCR test that's being used is simply a test that's not really viable for mass use.
That was what the people who created the test, the man who created it, they said categorically, I believe it says even actually on the boxes of the test, this is not a diagnostic test.
Exactly. And the reason for that is the test is it's a fiddly test to do because it involves amplifying RNA. It means that unless you have fantastically good control for the initial samples, putting them in and making sure there's no extraneous material in there, you can amplify all sorts of things in there that then give you a positive result, which really haven't got much to do with the patient. And the fact is, the vast majority of these tests are being done by people who've been taken off the street, trained up in a couple of weeks flat, put into a lab, and then gone on to do something else within 6 weeks. They're doing temporary jobs. I cannot see in a million years that there's any way that these tests are reliable. In fact, the company that does most of these tests, as far as I understand it, hasn't even been accredited by the body that accredits all NHS labs. They're very secretive about what's been doing. They're very secretive about their data. I think there are huge question marks over the reliability and validity of an awful lot of the information that's coming out of this testing.
Whether or not we can rely on the tests or not, and again, I'm sure the company and the government and others would have a different view on all of that. Whether or not we can the simple fact of people being in hospital, the simple fact of people dying, we have those figures given to us by the official figures. That tells us there are real cases, does it not?
Well, it tells us there are real cases of something. The question is, what are they? People are always in hospital at this time of year. The actual bed occupancy is no different from bed occupancy at this time of year. The question is why they're in hospital. So a lot of people, it seems to me, are going into hospital. They're being tested every day or every other day. The tests are unreliable. And so the point about the testing, it's not just brushable, assideable. It's absolutely crucial. The problem is the government don't understand anything about the testing, about the virus. They're totally reliant on SAGE. And SAGE and other government advisory bodies around the world, it seems to me, are all guilty of jumping on the biggest bandwagon that's come along in a century. It's very good for people's reputations and careers and their research grant input. But what they're doing is, by imposing draconian measures on the population, are causing enormous harms on the basis of data that's incorrect. And that's just, how do you solve that issue? I mean, if people simply won't listen, there is no exit strategy. And that's, of course, the worry.
There is no doubt at all. You only have to look at the graphs for this year, like 2020, to see that huge spike in deaths that we saw. Huge spike in deaths from coronavirus, from COVID in March, April, May, but also, of course, from excess deaths from lockdown. We know that a number of those deaths were caused by the lockdown itself, people not getting treated for heart attacks and like as well. However, when you look at the graphs for what is happening right now in January, what happened in December, what's happening through the autumn, are we seeing the same sort of levels of excess mortality? Because what we're seeing in these graphs were very scary graphs. But we're told 1 in 50 of us have coronavirus. That it's this exponential growth. More and more people in hospital. We're heading into a second wave. The NHS is going to be overwhelmed. More and more people are going to die. When you, as a pathologist, a trained pathologist, look at the data on mortality figures at the moment, are we seeing excess mortality?
In a word, we're seeing mortality that's within the envelope, well within the envelope of what normally happens at this time of year. The last 5 years have been a below average number of death years, if you look at the ONS data anyway, compared to the last 27, which is how far their data go back. So the fact is, the deaths we see, you can present these graphs in lots of different ways. Of course, most people aren't very good at looking at graphs, but the envelope within which we're in, we're below the average point of the deaths at this time of year. The question is, what are those deaths attributable to? A lot of them are being attributed to COVID incorrectly, in my view, because of the flawed testing regime. The fact is, the number of deaths, so the total number of deaths from COVID, this figure that we have of 70,000, equates to about 1 in 6 deaths over the entire 9 months that we've been looking at this thing. If you accept that about half of those deaths are probably not actually due to COVID, they're due to something else because of the testing problems, actually it's within the envelope of a normal sort of respiratory infection. The fact is, the only sustainable exit for this is for the population to come into equilibrium with the virus. As if you put selective pressure on the virus, it will change into a more easily transmissible form, which we've seen. One thing to look out for in the next few weeks is that because the testing is so inaccurate, as we vaccinate more people, we will get more. It's possible that we'll get more false positive tests. So it's quite possible that as the vaccination goes on, we'll actually see an increased spike in tests, which doubtless the government will become more hysterical about. The fact is, the whole hysteria should stop. The exit for this is that we protect the vulnerable and we let everybody else get back to their normal lives. There is no exit strategy other than coming into equilibrium with this virus. It's out there. We will have to live with it. And by the way, it's not killing everybody. It's actually doing what viruses do, which is killing the vulnerable and the weak and the infirm and the very elderly. That's what they do, I'm afraid. That's a fact of life, and there's no way of avoiding it.
Dr. John Lee, thank you very much for joining us. We will talk to many guests who will disagree with that. We hear both sides on my show. As you know, this is Talk Radio.